Hey everyone, David here, and I've got some exciting news to share. I've decided to write a book, and I've entitled it Psychosocial Hazards Are Real. The book is intended to help clarify the fact that psychological safety cannot be achieved without paying attention to the psychosocial hazards people are being exposed to. Despite how much individuals might be interested in treating others with kindness, dignity, and respect, many cultures are so full of psychosocial traps that no psychological health and safety effort can ultimately succeed. But to address psychosocial hazards, you first have to know what they are, and you have to have some idea what to do to address them. Though the book won't be 100% complete until the spring of 2025, I'd like to share a unique opportunity to reserve a copy during the book presale campaign. The campaign will run from September 16th to October 18th, 2024. This will be an opportunity to get one of the first copies of the book, tickets to the book launch event, and other opportunities to learn more about psychosocial hazards. For more information, you can go to my personal LinkedIn or Facebook page, or the LinkedIn, Facebook, or web page for ID2 Solutions. Don't miss out on this unique opportunity. Now, back to this episode of the podcast. The COVID-19 pandemic stressed our hospitals and brought many pre-hospital healthcare systems to the breaking point. However, in many cases, the challenges that EMTs, paramedics, and medical first responders faced were not new. We'll talk with a documentary filmmaker who's chronicled the challenges of our nation's emergency medical services system up next on this episode of the Psych, Health, and Safety USA podcast. From Flourish DX, this is the Psych, Health, and Safety USA podcast. As workplace mental health has become a global priority, there's a greater focus on addressing psychosocial hazards. Each week, we look at psychological safety from an occupational health and safety perspective. Let's talk psychological health and safety. Welcome to this week's Psych, Health, and Safety USA podcast. I'm your host, Dr. I. David Daniels, and I want to thank you for tuning in. Each week, we seek to increase awareness of the importance of psychological health and safety by learning from the lived experiences, research, and expertise of our guests, as well as advocating strategies to reduce harm and minimize vulnerability to psychosocial hazards in the American workplace. So, emergency medical service, or EMS systems, face several challenges that impact their ability to provide effective care, including staffing. So, recruiting and retention remain a significant issue for EMS agencies. There's a shortage of qualified candidates to fill paramedic and EMT positions. Funding. So, fire based and private EMS agencies have a difficult kind of funding model. Both struggle with billing patients and providing services under uh, the financial restrictions that are in place. Response and patient care, the environments in which EMS personnel operate are increasingly complex. Paramedics and EMTs face challenges delivering the expected quality of care due to factors like post-traumatic stress disorder and evolving patient needs. And apparatus and equipment, the high cost of ambulances and other related equipment strains emergency medical service systems across this country. And there are regular conversations about budget constraints and other challenges. My guest today has done a deep dive into the challenges of our emergency medical service system in the form of a documentary called Honorable but Broken, which reveals many of the issues that affect the care we receive before we see nurses and doctors in a hospital. So, we're going to get into the conversation by getting an introduction of my guest by my guest with this question: who is Bryony Gilbey?
Well, thank you for having me, first of all. Um, I am a journalist at heart, a writer, a policy wonk, um, a mom, and a citizen of the country. So I think that all of those things are very important influences or were very important influences on making this film. Um, I have a history of working at CBS and for 60 Minutes. And I've also done some writing for various newspapers and magazines, and worked on documentaries for Discovery Health, A&E, PBS American Masters. So this was my first independent film, but I really love the documentary format.
Wow. Yeah, you've kind of done this, well, some in our community would say at the big time level. With yeah, just honored to be able to have some time to chat with you. Another standard question I ask folks when they come on the podcast is, what does psychological health and safety mean to you?
Oh gosh, that's a broad question. I think in terms of employment, it means that you feel comfortable going to your job. You are handling, um, in this case, the patients that you're seeing and the other providers that you're working with. Um, and you're able to go home at the end of the day, or perhaps at the end of the week, and just kind of reflect on what you've done and be able to sleep at night. Um, I guess it's as simple as that.
Right, right. Yeah, the I asked that question of everyone because I'm really interested in the different perspectives that people take, because psychological health and safety, applies to everybody in every occupation, in every job, to include those in media. There are, I'm sure over the years that there are things that you have seen, been exposed to, heard about, had to report on, that as much as you want to put up the wall and have the professional distance from it, it has an impact on you because you're there, or you're having to, or you're interviewing the person who had the experience. There's that vicarious kind of trauma. Sometimes it gets passed along. So it applies to everybody doing all of the work that we do. But as it's often that people will think about how it affects others, and sometimes not think about really how it really affects them in the work that they're doing. Um, how does a person get interested in media? I mean, when you were a kid, did you always want to be a reporter, or so? How did you end up in media in general?
It's funny, I kind of fell into it. It was a little bit of a sidestep for me. I always loved writing. I loved politics and economics. And I had my heart set on working for the United Nations and being some sort of, let's say a policy wonk. I ended up writing some papers working for the Economist intelligence unit when I first got out of grad school, and love that writing aspect. And then heard about this job at 60 Minutes, and not being from this country, I said, "What's 60 Minutes?" Um, boy. So I kind of went into it that way, but to me, it was I'm a very visual and artistic person, and I love the fact that in television and on movies, documentaries, you can tell a story, and it comes in kind of like a pincer movement, like from both sides. You've got the words, the text, the information that you're being given. And you're also seeing this incredible visual of a person. And Don Hewitt, who's the executive producer of 60 Minutes, always said, "Tell me a story. I don't want to do a piece about Alzheimer's or this and that. I want to hear a story about a person who's dealt with this issue." And so he kind of I learned through that the power of that human story. And you're right, we did some fun pieces that were profiles of pop singers, but we also did a story about a cutting edge cancer drug trial, or a very religious family who had lost two children because they didn't believe in seeking medical care. So it was a wide range, and it was just finding that story. And yes, you learn to be sympathetic and to have empathy, even when you really don't think you want to. um, with people from all walks of life, and just and that's what tried to do with this film, was to tell it from the perspective of these incredible people who are in EMS, so that when you see it, when people who aren't in EMS see it, they think, I have to do something, I have to act, what can I do?
It is really really interesting how how roads come together. So one of the pieces that 60 Minutes did in 1977 was focused on the Seattle Fire Department and the Medic One system. And I started there a few years after that, as a matter of fact. But one of the things that I did while I was there was an instructor in the Medic Two Citizen CPR program. And when I started, that clip was a part of what we showed. That did we have film or cassette tapes back then? It was quite a while, but that was that was one of the things that we showed people as we talked about the work that 60 Minutes had done and shown how Seattle was, I think it was Morley Safer said it's the best place in the world to have a heart attack, and there is a real connection between that work and the pride that people have for being in the system, because they always go back to remember what 60 Minutes said. And so it's very interesting to be able to meet someone who actually worked at 60 Minutes, because I've never met anybody from 60 Minutes. So but but so so the healthcare system, again, I imagine that you said that you did a lot of different kinds of work. So what motivated you to do a documentary or a focus on the what I call the pre-hospital side of the healthcare system?
It was a story that sort of was in my periphery, because my oldest daughter was an EMT in high school, became an EMT. All three of my kids did the Youth Corps program in our town, which is a wonderful program, incredible people. And it was, for her, it was her, it was in her blood. She joined our volunteer vac, and I never saw her again. Um, and so I learned to appreciate through them. Then my other two became she became a paramedic during COVID, and my younger two became EMTs in that time, and just I was just fascinated. I've always had an interest in science. It wasn't my forte in school, but I definitely have an interest in it. And my daughter came back from a call. I think it was March or April of 2020, and it was like multiple stabbing in a house. And she'd arrived on scene. I think she was 19, 18 or 19. She'd arrived on scene with no PPE, and the whole house had COVID. And the police were there. I think they had to call the fire department to bring them. It was a mess. And those were the days when we thought it was the end of the world. And I was thinking, did you like? I think you said you're earning $11 an hour. Is that right? 11. And he's like, yeah, but that's EMS, mom. And I was just like, how? Why is that EMS? How is that EMS? That's this incredible job. These people that are frontline workers are in the face of this disease. I mean, that's just for starters. That's not all this other stuff that they do, the stabbings and the shooting and the accidents. And um, how is that possible that that's your salary? So that was really the genesis of the story. We got into it, started to look. My neighbor at the time was, he's in the film. He was a paramedic way back in the 80s, way back. Sorry, back in the 80s in the city. And we talked for ages about how it had come up, how the system had developed and why it was the way it was. And he said, if you want to do a story about it, I can certainly help you talk to people and open some doors for you. And I said, what, I think this is a great story. Um, and I mean that in the best possible way. I just think it's a compelling story, but it's also, this is a story people need to know. 'Cause, I mean, I consider myself fairly well read and surrounded by people in EMS at that time, and I had no idea. So it became this project, and I couldn't get much traction in terms of somebody wanting to do it with me. So I decided to self fund, and that's why it took so long to get to get it out. Um, but the more the more we filmed and the more people realized what we were doing, the more support we had and the more doors opened. And it just was an incredible experience, um, talking to people at all levels, um, from EMTs all the way up to, hospital administrators and physicians that were talking about how the system was benefiting no one.
Hmm. The amazing part of what you're sharing with me is I would have thought that this project was your inspiration happened, 3, 4, 5 years in advance of when the filming occurred. This was pretty close. I mean, I mean, this is almost happening in real time for you. You have, family members in the industry and you're, doing a documentary about the industry at the same time. That's pretty amazing. Really pretty amazing.
Well, it became a passion project. It just we did have to stop filming a few times, and there were times when we weren't sure we would even be able to get it finished. But it just something would happen. Whenever that happened, there'd be a few weeks of, oh no, what are we gonna do? And then something would happen. I mean, the NAEMT stepped in at one point and donated $10,000, and that was just, fantastic. That just took us to the next level. We had a wonderful paramedic who we were trying to get a big voice to narrate it, because we thought that would be a great way to get some attention. And we had kind of struck out with a bunch of people that we had approached. And this wonderful paramedic said, my uncle is a sound engineer for a few Broadway stars. Let me ask him if maybe he could reach out on our behalf. And sure enough, that's how we got approached Sarah Jessica Parker. And bless her. I mean, she was in the middle of so many other things at that time, and she came at the end of a very long day of interviews, by herself, by subway. She came down to his recording studio. She had seen the film, she had read through everything. She did a read through 3 times of every paragraph to make sure we had different versions that we could. I mean, she was just an absolute professional and an absolute sweetheart. And things like that just, just got us over each hump, and made us think like we're doing the right thing here. This is a very special film, and it needs to get finished and it needs to get put out there.
So how did wow. First of all, the story about again getting uh, Ms. Parker involved. I mean, that's that tells you that you're on the you're on certainly on the right road when things like that start to happen. So how did you did you have a network of paramedics or EMTs, or did you end up reaching out to people to kind of decide where you were doing some of the filming?
We had, through my daughter and through my neighbor, we had a number of people that we could approach in our neck of the woods, which with our budget was really very handy. And we also we had tremendous support from our county executive and our county EMS commissioner. We're very, very pro EMS and trying to fix the system just in our county of Westchester. And so they reached out on our behalf to the big hospitals in the area and said, and they knew some names of doctors that would talk to us. So they got us access there. Um, yeah, it really it was a very organic thing after that. I think and I had people calling. I had the EMS Memorial group from DC call, and companies got wind of it from around the country and were calling, how can we help? Montclair ambulance, which is one of the other places we filmed, said, our doors are open and everyone come and ride with us. Please come. We'd love to see you. We'd love to host you. So it really was. It was a group effort and very grassroots in that respect.
Hmm. Hmm. So this grassroots effort results in you going out into, you know, various places around the country, and and filming what was going on. What were, and again, you said that you had a family member who was in, EMS, but didn't know much about it, necessarily know a lot about it yourself. So what were some of the early on impressions once you started to gather this information in? What some of the early impressions you had about the system as a whole?
One, I was surprised it was even existing at any level. Just the numbers do not add up. Um, I was amazed that there are people who still work in that industry. I mean, I don't know how sometimes between the financial and the physical and the emotional stress, I'm not always sure how they're still doing it. Um, and I think also there was a resignation. That was what that was the worst thing, I think, was they're just like my daughter had said, that's just EMS, mom. There was this, well, we've been trying for decades to tell people, and nobody listens. Nobody cares. It's a very complicated fix in a lot of ways. It's probably going to be expensive because it hasn't been addressed in decades. It just seems to be insurmountable. And that sort of defeatism was really heartbreaking for people who are medical professionals. It just really upset me and the people who worked on the film. Um, and so it really, once we got it finished and we started hearing from people, how could they watch it? We were trying to get it on a major platform, but we really wanted to get it out so that at least there was a possibility of hosting a big screening. And I had no idea how popular that was going to become. Really made this film for people outside of EMS to say, we all need to get together. This is what's happening. We need to get together and do something. We need to call our congressmen, congresspeople. We need to write to them, call them, whatever we can do, get this changed, lobby on their behalf. They need our help. EMS has been there for us. Now they need us, and we should be there for them. Um, and instead, I mean, so far, it's mostly become providers and EMS administrators who have taken got access to the link and showed it to their own people and their providers and their legislators, county executives. They've used it as an educational tool, and that was never the intention. But I'm so happy that it's had that role. And we're flying with it in New York. We did a round the state tour, and we're trying to get it in every county. Um, we had a lot of luck in this last legislative session. Got a lot of legislation passed through the Senate. Unfortunately, most of it failed in the Assembly, but that's a job for next year. Um, but we certainly got the word out. We're building a huge coalition, and we're taking advice from other states that have made EMS essential, and advice on language, on approaches, on coalitions, and hopefully we can make a change in our state and then encourage others to do the same and support others doing the same.
So again, so what started off, it sounds like what started off as a passion project just to get the word out has now transitioned or now become almost an advocacy effort for EMS. Would that be accurate?
Yes, I definitely got the bug.
Do you need more psych health and safety in your life? Then head over to the FlourishDX Academy for several free on-demand e-learning courses. If you're an internal professional, follow FlourishDX on Eventbrite to register for any of our free fortnightly interactive webinars. Our flagship professional practice program is also exclusively available for internal professionals. The 12-week course blends theory, applied practice, and interaction with other professionals through live lectures and a monthly community of practice session. Find out more about all these learning opportunities or inquire about a bespoke in-house training at the Flourish DX Academy. www.45003.org. Now back to this episode.
You said that there were some work you're doing with the legislature there. What type of work was that?
So that self same paramedic who connected us with Sarah Jessica Parker, she created a group called Make EMS Essential, and um, through other leaders in the state, other counties, she made connections. There are a couple of others people, and they all got together and say we need to talk. We need to figure out who we need to talk to, and there was already movement underway, but this it just kind of coalesced in a really good way, like it hasn't happened before. And we worked with the New York State. What's it called? I want to say Coalition of Counties. That's not the right acronym, but Association of Counties. I think that's what. And they got the word out. We have some amazing state senators, Senator Mayer, who's in the film, Senator Kellis, who were putting the film, getting the film shown at Albany, and talking to people about educating other legislators. And I think we came up against a couple of somewhat competitive unions who were lobbying the assembly. That's the feeling that we get. But for unanimous support in the Senate, that was incredible. That was an incredible win. So we're hopeful that if we keep building those coalitions, that we'll get enough support to pass, because EMS is not essential in New York State, and that is insane.
Yeah, I think there may be people who are, listening or watching who would be surprised by that. That emergency medical service. So, we're talking first responders, EMTs, paramedics, ambulances, rescue tools, all those kinds of things are not considered an essential service in New York. That's what you're telling me. And there are probably of and I'm I'm having you share this. I think people are always surprised because they think that these services simply have existed forever, and of course they're essential because we spend lots of money on them. But in many cases, we aren't spending near as much money as people think either. They think, oh, there's X number of dollars. You obviously can't be spending that much when you're paying people $11 and $12 an hour.
Right. Yes, absolutely. I mean, a lot of it is the reimbursement model is just a terrible model. Um, and as you were saying in your introduction, we're asking more and more of EMS. I mean, there are many, many more EMS calls than there are fire calls, and increasingly so. That's not changing. That's not going away. And people are living longer, which means they're having more health issues. They're heavier. It's just we're asking so much and increasingly more of EMS, and we're paying them the same. It's just, and it means in terms of mental health, it means that not only are they maybe not processing all the trauma that they're seeing, um, but they're also, which is like immediate and also cumulative. But they don't have the healthcare. They don't have the um, facilities to go and seek help because they don't have medical coverage. I mean, that is literally the definition of insult to injury in my books. And so it's just not sustainable. It's not sustainable, and that's why I was saying I'm amazed it even is as robust as an industry as it is, because I don't know how they're doing it.
So again, just to clarify for folks who may have missed what you just said, you are telling me that there are people who provide pre-hospital health care but have no health care of their own.
Absolutely.
Okay, that's horrible. That's absolutely horrible. And one of the topics I try to connect to when I'm having these conversations about psychological health and safety is there is no way that you can be physically harmed without being psychologically harmed first. I mean, so all of these things that we are saying are going on physically, people don't have health care, can't get right to the hospital, can't that in and of itself is a psychological impact on the person, even if the physical thing doesn't necessarily take them out. And in many cases, particularly for providers, it is again a point I think you made. It's the cumulative effect of I really want to help people, I want to do a good job, but I'm struggling myself because I'm asked to work more shifts, I'm asked to do more things, and I can only do so much. And unfortunately, the way many of our workplaces are set up, that all of the risk is on the worker. And when that risk becomes so unbearable or such that they can't do a great job, then they get more. So you made a mistake in the field, often because you were working too long. Uh, I've had too many calls, and then you make that mistake, and then we go after you even more. It gets even worse. So then you wonder why people, you know, eh, it's amazing. Again, to another point that you made, that some people stay in it as long as they do.
Right. I mean, it's not just the lack of health benefits. There's no pension, there's no paid time off. It's just such a terrible way to treat people. Um, and they really don't have any recourse. They're not allowed, they're not able to strike. I think even if they were, they probably wouldn't, because their instinct is that they're there as carers. And they are, if you think about situations where EMS responds, it's typically in tandem with the police or the fire department. So they are seeing and experiencing all of those same societal events. And sometimes there's violence and they're not armed. Um, a lot of them have been attacked. A lot of them have felt very threatened at times. And yeah, I mean, I think we talk about in the film about EMS being a stepping stone. I think people do it to get experience, and they go in with their hearts full. They really want to do this. It's a very stimulating and exciting and just worthwhile job. And then I think that it's just overwhelming. The actual There's no break. There's no time to recover. Um, if you want to get paid. So I think people, they do that and they go on to become something else.
Yeah, and then that becomes this self-fulfilling kind of system that says, well, we don't have enough people, but the people that we have, we overwork them, so we have even less. And this is where, again, this is why I believe that a focus on an organizational focus on psychological health and safety is so important. It is so important. These are human beings. And as much as we've told people, oh, suck it up, don't worry about your feelings, push through it, that type of thing, human beings can only push through their feelings so far. They can only do so much. They can only be exposed to so much before it is too much. And then the very thing that you've asked them to do, they aren't able to do it because they break. And I, the title of the documentary, I think, is really in and of itself compelling. That it's an extremely honorable thing to do. Extremely honorable to literally, to put your hands on people who are dying, to give medication to people who will die if they don't get the medication. It is, and it's not hyperbole to say that, because that is the case. I mean, I again spent a bunch of years in the fire rescue service, and have and finally came to realize, and some people don't recognize this as well, but so the United States spends couple $100 billion, about 150 billion last number that I saw, on staffing fire departments in this country. But only about 4% of what they do is actually go to fires, 4% or less. Most of what they do is emergency medical service. And some have emergency medical training, some don't. Some are paramedics, some are not. And even in a state like like New York, the New York City Fire Department, largest fire department in the United States, but the vast majority of what they do is provide EMS service when they merge the EMS system into the fire department. But people don't know that. They see the colors and they see FDNY and all that type of thing and think they're the same people, and they are not even necessarily the same people because they don't get paid the same. They don't get the same benefits. They're often exposed to all of the really bad things, and sometimes they're even treated differently. That's a whole. And again, this is outside looking in, and I'll certainly say that. But just the stories that I've heard and the people I've met in the system, that those systems aren't equal in and of themselves for all kinds of reasons, but none of them are good ones. Because again, these human beings are there to provide a service that they can't provide if they aren't taken care of. They just can't. They can only do so much.
I mean, there's an argument for, I've heard it many times, usually from the fire side, of merging the two services, fire and EMS. Just it makes sense in terms of having the same headquarters, having the same responses, having etc. But you're right. There's EMS is treated. They describe themselves as the redheaded stepchild, and nothing against people with red hair. Sorry, but that's the phrase they use. It's just that, and it's ridiculous because the people who are in EMS have more training, especially paramedics. They're far more highly trained. But it's also when you think about the types of people that want to become firefighters and excel at being firefighters versus the types of people. It's a different personality. It's a very different personality, and I personally think we should just get a proper EMS federal organization, centralize it, take it away from the Department of Transportation, and maybe put it under Department of Health, or give it its own agency. I think that it needs one voice, that organizes at the federal level and helps the state at the state level, and we resolve the reimbursement. And it shouldn't even be reimbursement, it should be compensation. They should be compensated. They should have proper salary and benefits, and pensions and days off, and I mean that should just be a given, and then the rest will have to be figured out through the state budget, county budgets, however it works. But part of making EMS an essential service by law is that then you're required to then provide it. The government at all levels is required to provide it. And so then you have to figure that out. But at least that's a step in the right direction. That's why we were going for that. I mean, police and fire in New York State are also not considered, by law, not considered essential, which blew my mind. But they're baked into every budget at every level.
But yeah, by existence and tradition, but not by legislation, which is and the other piece that I think is really important, and there are arguments on all sides. I'm not in the argument one way or the other. I but there are arguments on all sides about which is the most effective way to provide this. The part that is most important to me is these services, if they're going to be provided by human beings, should be first centered on or focused on how do we create a safe environment for these human beings to provide the service. And I think that's where a lot of these systems go sideways, is they skip over the human beings and start talking about, well, we're going to do this for the community, that for the community, we're going to do this, and we start making promises that nobody really asked for, or not necessarily. People didn't necessarily ask for that because the conversation wasn't had with the people who need the service. And then all these systems are built and we shove human beings into the system rather than looking at the community and what the communities want and what they want to fund and what they want to pay for. I think the reality is that some communities probably shouldn't have these systems if they can't do them correctly, because you're putting people at, it'd be better to not have it at all than to have it and have be putting people at risk to make it work. It's either do it right, or perhaps it shouldn't be done at all, or it should be done certainly a different way, because we should not have, the type of system that puts it all on the back of that, that poor EMT, who again is understaffed, under resourced, not supported, and expect them to go out in the field and fix the problem. That's really just not good. It really isn't
It's
good.
not good, and it's led to so many suicides. I mean, first responders in general have a higher suicide rate, but EMS is, I believe, is the highest of all.
Well, yeah, last data that I've seen is that, you're more likely to die as they kind of lump together, firefighters and EMTs, but you're more likely to die by suicide than any other hazard, any other situation you're going to be exposed to. And again, that is the ultimate outcome of being exposed to too much psychological and emotional stress, too much. Uh, so um, you saw a lot about the system that, frankly, just doesn't work all that well. Um, what did you see that really seems to be working well, though? Is there any component of this system that you think is is working pretty good? It could be better, but is actually working fairly well.
It's hard to generalize. I've definitely seen systems where money has been given. They have a really good funding system. Um, Vac, which is in Westchester, is incredibly well funded, and you can see the difference. You can actually see they have counseling if they need it. They have proper payment. They have proper pensions. They have days off. Um, they have all the equipment they need. They have bulletproof vests. They're just supported at every level, and it's amazing to see that as a as an outlier, because you would expect that that's what these people should be given. Just um, I've been doing some further work for a different film on a system in San Antonio, Texas. Texas is a little bit different. They have a lot more freedom, the EMS director, to decide what EMTs and paramedics can actually do, what their purview is. And I've seen a system there that is incredibly efficient. Um, for example, we were in San Antonio a few weeks back, and their dispatch system is unbelievable. I mean, to become a dispatcher, you have to have had 5 years in the fire department and 5 years in EMS. So all their dispatchers are paramedics. And when the 911 call comes in, they can say, you know what? I think you're okay. I think you don't need an ambulance, but maybe take a taxi to the, and they can triage the calls, um, and FaceTime patients, and it's much more. It makes the EMS system much more efficient. And when you see things like that, there's so much that EMS can do, if given that support. And we're seeing that in community paramedicine. I've seen some wonderful programs in that too. That's a very positive thing, especially for homebound seniors, people that can't get out of their houses, going in, checking up, people that maybe that are repeat patients, checking in with them regularly, and so they don't have to go to the ER. They don't have to go to urgent care. They have another resource that's there, and um, I have seen some efficiencies in that type of approach. So I think if we support the system, we're going to really make healthcare in general much more efficient.
Absolutely. Yeah. Yeah. That's actually encouraging to hear that, because I just I'm probably a little jaded, having been inside the system a while and seen some across the country, that there are a lot of these systems that really don't work well at all, but there are some that do. And so it's not a lost cause. It's not impossible. It is simply getting people to recognize that, first of all, communities have to decide what it is that they actually want. And I think a lot of this goes to the leadership of these communities, both elected and appointed leadership, to be honest with communities and tell them what is really going on. I used to say, and I was a fire chief a few times, and my description to people is, we can provide as much service as you're willing to pay for. It's not right or wrong, good or bad. There are places in the United States that have 30-minute response time, but there's very few people out there. I mean, they know that, or they supplement with people who will volunteer their time. There's not a right or a wrong or a good or a bad way to do this, but I think we just aren't honest sometimes about the real the limitations of a system, the opportunities that are available, and folks will run and get oh yeah, we're gonna add more of this, and then we aren't really honest about the data, the response times. Oh, everybody's gonna have 5-minute response time. Well, no, they probably won't. Not with the level of funding that you provide this system, that probably won't work. And simply telling people, and again, what I also find is that even communities, if you tell me that I'm going to have to do something until you show up, that's what makes the Seattle King County Medic Wind System so effective. It's not the medic units, and it's not, I mean, that's a part of it, it's important, but they can't be everywhere. It is the roughly 2/3 of the population that are trained in CPR. They have something that they can do. It is, and I use this example. I had opportunity to travel to Israel some years ago, and everyone in Israel goes to the military, which means virtually everyone has some first aid training, and everyone gets involved because they think they're supposed to. What we've told people is, well, have to wait for the professionals to show up, and people don't know anything. So we're going from nothing to professionals showing up, and that's another area where, as communities, that doesn't cost as much, but people need to know. I mean, and if I'm living my life and doing my thing and doing, I have my other occupation, I don't know anything about that. Someone has to share with me the part that I can do, because we're going to have to fix this together. The EMS system cannot fix itself alone. It's going to need all of us to kind of work together to cause this to happen. And thankfully, there are folks like yourself who've taken the time to capture this information, put it in one place so people can see what the system really is now. And hopefully it gives people hope, that it actually can be better. Identify it's not what it should be. It doesn't work the way we want it to. It's having a deleterious effect on the human beings that are doing it, but it could be better. It actually could be better. So if there are folks out there who uh, they want to learn more, they want to get an opportunity to do a screening, to they want to get information out about the documentary itself, how would they do that?
So we have social media sites. Honorable but broken is our tag. And we also have a website, I think honorablebutbroken.org, I want to say. Um, and on there is all the information about the film, about the fundraising, about how to organize a screening, how to ask for a screening. Um, and I have actually, in the last couple of months, I've been working to get it on a bigger platform. I do know that we have been picked up by Amazon and 4 other smaller platforms, but I have not seen it available on any of those platforms yet. So I keep hitting refresh, refresh, refresh. And I will announce on our website as soon as I get the good news. I will announce that it will be available on those platforms. So I'm hopeful. But in the meantime, we've had screenings across the country in so many states. Um, and we're trying to get a bunch of EMS. We were up in, what was the fire? FDIC in Indianapolis. We went to the California Ambulance Association meeting this fall, and the Ohio Fire Chiefs conference this fall, and EMS Expo this fall. So there's still a lot of interest in showing it to people within EMS. But yeah, we've really got to get it outside to the general public, and push for it, I think, state by state at this point. But there are a lot of people out there in every state that really want to see things improve. And I think it kind of builds on itself when you see that there's interest and other people are doing it and people are talking about, well, what did you do? What did you do? And support. I think then that feeling of hopelessness that I was talking about in the beginning, that defeatism, starts to get chipped away at. And there's a new energy, especially in our state right now. I can't exactly speak for other states, but there's definitely a new energy in EMS, feeling like this. We've actually got this. This is going in the right direction now, and we have a chance of getting things changed. So, yeah.
Yeah, again, thank you for the work that you're doing on this really, really important effort. It is, as I said, EMS is going to affect virtually all of us at some point in our life. It just will. I mean, either directly or indirectly, it absolutely will. And it's important that we, again, basically just understand what we have and make some really objective decisions about what we want it to be, and not be surprised about how it, what it produces and what it doesn't. And I think, like, like many challenges we faced as, as a country and as a species, when we decide we want to fix something, we fix it. We do. We can. Yeah, we can do this. But it's excellent, great to have voices such as yours involved. And this is again, the first of a couple of conversations. We have matter of fact, our next episode coming up, we're going to talk with someone who worked with you in doing some of the filming and getting out in the field. So this is a interesting kind of two-part conversation, but we had to start with the person who really got this started. So again, thank you very much for the work that you've done and for this wonderful documentary, Honorable, but Broken. Thanks very much. So if you're watching or listening to the podcast for the first time, welcome. I hope something you've heard will bring you back to another episode in the future. Previous episodes of the podcast can be found at psychhealthandsafetyusa.com. You can watch, like, subscribe, and share the podcast on the Flourish DX YouTube page. And please do join the Psych Health and Safety USA movement by connecting to us and becoming a subscriber on LinkedIn. So until next time, stay tuned. Look out for the next episode of the Psych Health and Safety USA podcast. Tune in each week for new episodes of the Psych Health and Safety USA podcast. If you have a story or know of one that needs to be told, reach out to us on LinkedIn or send an email to david@id2-solutions.com, or go to the Flourish DX website at flourishdx.com. We'll see you next time.